Good afternoon. My name is Diane Varga. I'm with Family Partners of Morris and Sussex, and I welcome you to this week's Lunch and Learn. Today is August 15th, 2024, and our presenter today is Camilla Vaudry. She is the Community Health Nurse and Educator with Horizon Blue Cross and Blue Shield of New Jersey. And Camilla, if I have this correct, you will be talking about Medicaid literacy, NJ Family Care, and the Cover All Kids presentation.
Correct.
Okay, welcome.
Thank you. So good afternoon, everyone. It's a pleasure to be here with you all today at the Lunch and Learn. As Diane mentioned, my name is Camilla Vaudry. I'm one of the community health nurse and educators for Horizon Blue Cross Blue Shield. And so part of my work at Horizon is really bringing in information, topics, and though New Jersey Family Care is under the department that we work with, Medicaid. And so I cover a variety of different topics, including health education topics. But for the sake today, we're going to be talking about New Jersey Family Care, Medicaid. And so I know a lot of the times people get confused with Medicaid and Medicare. And so I'm going to just talk a little bit about the difference. So for today, we're going to be referring to Medicaid. So New Jersey Family Care is the name of New Jersey's Medicaid plan, and it provides it's a coverage program that provides free or low cost quality health care for adults and children. And so Medicaid and Medicare are both government programs in the United States that provide health insurance, but they serve different populations and have different eligibility criteria, coverage options, and funding sources. So in terms of Medicaid, it's designed to provide health care coverage to low-income individuals and families, including children, pregnant women, elderly individuals, and people with disabilities. Now, normally with New Jersey Family Care, for those that reside in New Jersey, people can qualify if they have a minimum 5 years residency. They don't have to be a U.S. citizen. They have to be a resident. There are other criteria if they are asylums, refugees. Those individuals would also qualify under a different criteria basis. But for those of that are recently coming in or migrating from another country, they have to have the residency part of it, so 5 years. Now, other people under the normal criteria that would qualify is pregnant women. So if a woman's pregnant and she is not documented, she would qualify during the entire time that she's pregnant. And then 365 days postpartum, she would get what is called like an emergency Medicaid. And that's not the standard Medicaid that I'm talking to about, but I just like to throw it out there. And so the Medicaid coverage, a wide range of health services, including hospital stays, doctor visits, long-term care, preventative services, and more. And states have some flexibility in determining the specific benefits offered. So New Jersey is a very robust state, and we're fortunate to have a lot of coverage in terms of other states that may not necessarily, their Medicaid may not be so robust. All right. With Medicare, so Medicare is a little bit different. I know that people get really confused because the names are kind of similar. So I'm not going to be talking about Medicare, but I'm just quickly going to go over Medicare is primarily aimed at providing health coverage for individuals who's aging into 65 or older, as well as certain young individuals or someone who has a disability that's deemed disabled. They would qualify for Medicare before turning 65, or those with end-stage renal disease as well. And ALS. Okay, but just wanted to mention here that there's a big difference between Medicaid and Medicare. And so once somebody enrolls into New Jersey Family Care, once they get accepted, they can select from 5 HMOs. So, oh, I'm sorry, I didn't realize that was being shared. So HMO stands for Health Maintenance Organization, and we are one of the HMOs. So the HMO is the one in charge of providing the health coverage program to an individual. And so HMO, the person, once they do the application, can select from 5. So Horizon is one of them, WellPoint, Fidelis, United Healthcare, and Aetna. So all of the plans cover the same thing because we're under the New Jersey Family Care umbrella. The only difference is that Horizon has the most in-network physicians. So most of the doctors take Horizon over maybe another plan. All right. So there are a couple of ways. That New Jersey, someone who wants to apply can apply. One is through NewJerseyFamilyCare.org. They can apply themselves. I know for someone who may be, first-time user, in terms of New Jersey Family Care application or the site might be a little bit confusing. That's where you can always connect with me if you have somebody who is interested in enrolling. Now, we don't determine the person, we don't make that eligibility. That would be New Jersey Family Care. So we always welcome everyone as long as they kind of meet the criteria, especially the income criteria, then that would be something that they'd be able to apply. But we don't like deny anybody. That's not us. We would, the community health rep would assist the individual to apply for New Jersey Family Care, and then they would hear back from New Jersey Family Care separately. And so the person can also visit their county's Board of Social Services. Every county has one, and they can apply there, or they can call New Jersey Family Care at the 1-800-701-0710. So I'm going to share my email on the chat. If anybody, after I finish presenting, if anybody has anyone who's interested or may qualify about New Jersey, with New Jersey Family Care, you can connect them with me, and I can also connect. I will also send in the email that we receive. It's a community outreach email specifically for those that want to apply for New Jersey Family Care. They can certainly send an email. And now they don't have to choose Horizon, right? So whoever, I know that the community health coordinator outreach, or, the rep works for Horizon. They don't necessarily have to select Horizon at the time of application. So they can select another HMO, even though the health rep works for Horizon. So I just wanted to make that clear. Once the person applies, it's going to take about 45 days for the application to process. Within that time frame, the person should be receiving some kind of eligibility form in the mail. And so that form will either say they got denied, they got accepted, and they may need some additional proof like license, maybe passport, proof of address, those kind of things that they're going to be requesting in order to continue on with the process. So the entire process, sometimes lately it's been a little bit more than 45 days. There's just a lot going on with the state. And so what I always encourage folks to do, it once you apply for New Jersey Family Care with whatever method you use, at the end of the application, if you do it online, you're going to get a confirmation number. So that confirmation number is going to serve as proof that you joined, that you enrolled, right? And so you want to keep that confirmation number handy, right? Because in the event that you don't receive a letter or something happens, because these things do happen, you can call New Jersey Family Care and then have that confirmation number, and they're able to look you up in the system. All right. Now, if you do it by mail, then that's something that, it's kind of out of the way that we can't really track. And so I always tell folks just, best to do it online. That way you can track your confirmation number. Okay. So this slide here specifically for our members. So if you have somebody or who is a Horizon NJ Health member, they can easily download the Horizon New Jersey Health Medicaid mobile app on their smartphone device. And so it's nice because they can create like an account, and it would be their member portal page, and they're able to go in and they're able to access a lot of the things that normally sometimes you would have to go to the website for, or maybe you have to call member services number and wait. And so they can easily have access to those resources there on their phone. So they can find a doctor, they can change the name of they can change their primary care provider at any time directly from their app. And really the other neat thing that they can do is they can download a virtual card onto their phone. So sometimes it happens where, we have a lot of cards and we may not bring that card with us at the time of the appointment, whether it's a dentist appointment, eye appointment, or a regular medical appointment. And so if you have Medicaid, sometimes the provider won't see you without that card. And if you don't have your physical card, if you have the Horizon NJ Health app and you can download the card, you can utilize that virtual card. You can show it to them and they'll accept it as if you would to have a real physical card with you. So that's really nice to have. And if you have any members or encounter any members, or you're a member yourself, you can, download that app to have. So this is another thing that's very important. When somebody applies for New Jersey Family Care, so remember, New Jersey Family Care, you have to qualify for. So it's not like, I guess it would be like any other insurance you have to renew, right? If you have an employee sponsored health insurance, you also every year have to renew or change your insurance, kind of update on what the coverage you want. And kind of the same goes for New Jersey Family Care. So what I want to remind everybody is the individual who has New Jersey Family Care, they have to renew their benefits every year. So what happens is that New Jersey Family Care will usually never call unless they need something like permanent from you. They will send a packet in the mail. So a lot of the times, maybe somebody may move during the year and they forget to notify the state that they moved, and so the packet gets sent somewhere else, and then that person goes to the doctor and their coverage is cut and they would have to reapply all over again. So always keeping up with your address, and any changes with the state would have to be made during the year if you do move. And so that every year they'll send you about, so for example, let's say the person enrolled today, August 14th, or is it 14th or 15th? I'm sorry, 15th, August 15th. And next year, about 2 months before, so around June, end of June, July, they're going to be getting that packet. So the state gives everyone enough time to fill out that renewal packet with any question or with any necessary documents that they may need. Everybody's different. Sometimes they just need to refill out the form, the income, those kind of things, and then send it back, and then they'll continue on. There's nothing else for the member to do on their end. All right, and this goes for anyone, not just Horizon members, anyone who has New Jersey Family Care as their health plan. All right. So New Jersey Family Care also, January of last year, this exciting program enrolled it's called Cover All Kids. So Cover All Kids is great because it gives coverage to those children under the age of 19 who normally wouldn't qualify for Medicaid, are now qualifying. So they don't have to meet the normal criteria where they have to be documented or they have to meet some sort of income. So if somebody has a child or somebody comes from other parts of the country and their kids, or they're residing in New Jersey, they can qualify for New Jersey Family Care under the Cover All Kids program. So since then, we've enrolled many, many, many families with children who now have healthcare. And this is a big thing, especially for school children. When you first enroll when somebody's coming from another part of the country and they're newly migrated to the US, let's say, specifically to New Jersey, they're able to now get those preventative health services that maybe the parents would have to pay for otherwise, right? Because remember, with if the child starting kindergarten, any child starting any kind of school in New Jersey, they need to have their vaccines updated. And if you come from another country, some of the vaccine requirements are not the same as the requirements here in the US. So they will be covered for that as well. So this is a great program. If you have anyone, if you work with anyone who has children under the age of 19 who don't have who is undocumented or who are not supposed to be living, like not coming into the US to stay permanently, but they could, if they plan to live here and make New Jersey their home, they're able to qualify for this plan. So this is really great for those folks. This is pretty much what gets covered in all the in the entire program, not just for Horizon members. They're going to get access to medical providers, right? So a primary care physician, which I mentioned earlier, that they could change at any time for whatever reason. And I always tell folks, not just for anyone who has New Jersey Family Care, but in general, if you ever, have a primary care doctor office that you don't like going for whatever reason. You know, I find that sometimes people are a little intimidated by changing into another provider, whether it's because they feel like they're, you know, have to go to that one, or maybe the paperwork would be too much to transfer over. But remember, if someone who is not comfortable going to their primary care provider, whether it's something they have with the doctor or the staff, whatever the case may be, a lot of the times they don't share the information in terms of their health. And that only does a disfavor for the person, right? So anytime, I always tell folks, just change it over. Most of the times everything gets transferred, all the medical records gets transferred over electronically. There's nothing to do on your end other than sign a HIPAA form that you're allowing the office to fax over the information to the new office. So as long as they take the plan, right, you should be good to go, or the person should be good to go. But again, with the primary care physician, it's really for anyone, for everyone, you know, to go to someone who you trust, who you, and I don't want to say enjoy going, because nobody likes to go to the doctor, but at least have some kind of healthy relationship with their provider in the office. Specialty care is also covered. So if an individual needs to go to a specialty doctor, cardiologist, pulmonologist, podiatrist, I think I said pulmonologist, any specialty doctor, it would be covered as well, as long as they take the plan, right? So they would have to either look up on the app, the Find a Doctor app, on the smartphone or on the website, to see if they take the plan, or they can just call the office. A lot of the times they can let you know, yes, we take the plan, no, we don't. Other thing that gets covered, and remember, with New Jersey Family Care, the person pays nothing. It's zero out of pocket. Nothing, nothing, nothing. It's zero copay, zero everything. Dentist is another thing that gets covered. So routine care is important, along with, you know, our physical health, but dental care is also important. So they're going to check for oral cancers, right? And that usually happens twice a year. So twice a year, you should go visit, the person should go visit the dentist. They're going to get the cleanings, the x-ray. Sometimes they do it twice a year, but at least definitely once a year. Anything outside of routine care, so cavity fillings is part of routine care, but anything outside of routine care, like if the person needs to have their tooth extracted, or they need to have a root canal or an implant, something along those lines, that would be on a case-by-case basis. And the doctor or the medical, you know, the receptionist there, who does the coding and all, would follow up with the insurance in terms of claims, and they would negotiate that. And it's really up to the insurance to see if they determine to be something that's needed, or is it cosmetic. Eye care is also important, so it's also part of the plan, and that's usually once a year. Once a year, they'll get the eye care, that, you know, to check your eyes, and then also the frames. They're eligible for one frame a year. So hospital care. So I like to differentiate the difference between hospital and urgent care. That's also covered. So urgent care, they're really all over now. They've been really growing since the early mid 2015, 2014. There weren't as many, but now they're really all over. And urgent cares are great because they're open all year round, 7 days a year, 365 days a year, 7 days a week, extended hours. So urgent cares, depending on every urgent care is different. If the person has New Jersey Family Care, they should, you know, always encourage them to call and make sure that they take the plan. Sometimes they'll take New Jersey Family Care, but they'll not take one HMO over another HMO. So they'll ask at the time, like, what HMO they have. Do they have Horizon? Do they have Aetna? Do they have United Healthcare? And so the person who has New Jersey Family Care, they would have to just let them know which plan they have, which HMO they have. And so it's nice to have that urgent care there, because urgent care is there for urgent matters, but that's, you know, not life-threatening. And sometimes it's not your medical home. So it's not somewhere you would go to have preventative health screenings, but it's something that you can go to if your doctor's office is closed, which sometimes some of these incidents happen like after hours, right after 5. And so at the urgent care, they do a lot of different services. They do x-rays, they do flu vaccines, flu shots, if you need pneumococcal vaccines, or just you don't feel sick, like a sick visit, they'll take care of you there, right? So the hospital is another thing that's I always like to differentiate. So hospital ER visits would be covered, but I always recommend or encourage folks that the reason why hospitals are there in the emergency room, I'm not talking about outpatient services. Like if you go to hospitals to have surgery, that's different. That's something that would be established beforehand. But I always want to, discourage individuals, whether you have New Jersey Family Care or not to go to an emergency room for like a cold or like something that's not considered an emergency. And I can't tell you how many times people do. And so not only is it costly for any insurance, it's going to cost a lot of your time and the person's time, right? You're going to be sitting there for a long time because whatever the issue is, if it's not an emergency, they're not going to see you right away, right? They're going to take care of do the triaging and they'll take care of something else that's, higher priority. And then the person gets susceptible for other germs and other things because everything and anything walks into that emergency room. If you've been to one, you would know it's not the prettiest sight. And so, I always like to remind folks, use the urgent care for those things, or your primary care, and the emergency room, we'll leave it for emergency matters only. And then we have labs would also be covered. So during a person's physical, which again, wellness checkups are covered, whether you have New Jersey Family Care or not, any insurance you have, the wellness checkups, which happens once a year, is also covered under the plan, and blood work is included as well. And then pharmacy. So pharmacies would be your standard, general generic prescriptions would be covered as well. Benefits overview. So this is quickly just going over some of the cards that the individual would get if they enrolled into New Jersey Family Care. So the first one here is the State of New Jersey Health Benefits Identification Card. And that card is the Medicaid card. It's just showing or letting somebody know that this person has Medicaid. And that's one of the first cards they get once they get deemed eligible to the program. And they get that letter of confirmation. So this is not the insurance card. A lot of times individuals get confused with this card. They think this is the insurance card. So this is not the insurance card. This is the Medicaid card. Sometimes individuals have other programs within the Medicaid program. So if someone wants to apply for not for New Jersey Family Care. If someone wants to apply for food snaps, right, food stamps, the person at the Board of Social Service would ask for this card, those kind of things. Or if somebody wants to apply for SSI, something like that, they would show that they are a Medicaid recipient. The other second card that the person would get is the New Jersey Family Care card. So the New Jersey Family Care card would have New Jersey Family Care on top, regardless of whatever HMO they select. And it's going to have Horizon label on there. So it'll say Horizon with the name and all the information on there. And that's the card that the person would use for their healthcare needs, right? To go to the dentist, to go to the eye doctor, to go to their primary, and for the pharmacy as well. The program down here, the Managed Long-Term Care Services and Support, MLTSS, is a special program. They would have to qualify. So they would have to have some sort of disability, right? And this is mostly for those that are very sick, right? So this is a different program and not everybody qualifies for this. The other one is the Horizon New Jersey Total Care. So Horizon New Jersey Total Care, in order to qualify for this plan, the person would have to have a Medicare. They would have to have Medicare and Medicaid together. And so it's considered a Medicare Advantage plan, which combines the services of Medicaid and Medicare while providing an additional benefit as well. So the person would get like an OTC card. They would get like some of the local gyms covered. So it's a very neat program. And again, everything is zero premium, zero out of pocket cost for the person who qualifies for this program. Okay. This is just how to read, very self-explanatory how to read the card. A lot of the times, those that are qualifying or apply for New Jersey Family Care, they're not familiar on how to read their cards. So, the member services number is usually located in the back of their card. And I can't tell you how many times people don't realize that the member services number is right in back of their card. And they can, easily dial it if they have any questions in terms of the benefits, their claims. And again, if the person has the app, they can easily look at the claims on their app as well. So it's nice to have the app there. I went over that. And this is just some of the programs that we have. So this is specifically for our Horizon NJ Health members. So the first one, I want to say that every HMO should have one. The Care in Case and Disease Management Program is a program which a member is assigned a nurse, right? Their case manager, and they help address any barriers or anything they have in terms of their health, right? So maybe the person got newly diagnosed with diabetes. They have questions around their diabetes medication, some diet. They can connect them to resources in terms of dietitian, nutrition, those kind of things. And the nurse is there to really help, whether they need access to transportation as well. The nurse can, guide the member or assist the member to getting transportation, especially if it's transportation for going to and from a doctor's office. The Moms Gems program is a great program for those who are pregnant, right, and have Horizon NJ Health. GEMS stand for Getting Early Maternity Services, and this program is designed to help expecting mothers with, making sure they're going to their appointments, so they have any questions. And the GEMS program, they will follow them about 12 weeks postpartum, which is nice, right? So during pregnancy, sometimes mothers, especially for first-time mothers or a mother who's newly coming into the country, may not know all the services and everything that we have to provide for her and her baby, right? That program is really designed to help enforce all the wonderful resources we have for the members and for expecting mothers in general. The other one that I'm going to highlight is the Education Works program. So this one provides assistance and guidance for our members to complete their high school equivalency exam and receive their diploma. So if there is a member, a Horizon NJ Health member who was not able to finish their high school or GED, they can enroll in this program and Horizon will assist them with getting their GED. And I think that this year, so far, we've had a couple of members who were able to complete. So we also have somebody who's in charge of managing this program, which is really neat and really great. And that's actually, this is the Neighbors in Health program that was developed in partnership with Horizon Blue Cross Blue Shield of New Jersey, really to help any need. So when it comes to Horizon, so I know that sometimes we don't look at insurance as a as like a part of the community. They just think, oh, it's Horizon, it's an insurance. But I work for the community outreach department, right? The member advocacy and transformation department. And so I work out in the community. So I am always looking for organizations. We work with state faith-based organizations, fairly qualified healthcare centers, community-based organizations. And, I really like to highlight some of the programs that we have internally and also other programs that are out for, open to the public for everyone. So I kind of serve as like that middle person, right? As a resources for our members and for those out in the community. So I like to be involved in a lot of the community programs, and we cover all 21 counties in New Jersey. So we do a lot, and I'm very happy to be sharing this information with everybody here. So I'll pause here. If anybody has any questions, anything really, even if I didn't mention it, or something along outside of what we're talking here, I would love to hear your feedback or stories.
What I will do, if it's okay with you, Camilla, I'll stop the recording now.
Sure,
This way,
no
if
problem.
anybody wants to ask questions and not be on camera.
Of course.
But before
No
I
problem.
end, I do want to thank you for your time and sharing this important information.
Of course.
For anyone who hopped on early, we will have the presentation available to you on the Family Partners YouTube channel by next week. So feel free to go on there and look if you've missed any part of the presentation. But I'd also like to thank everyone that joined us today. So I'll stop the recording now, and then you can feel free to unmute and ask questions.